Hi everyone, Dr. Amna Husain, board certified pediatrician, board certified lactation consultant, and mom. So today we're going to be doing something that we don't often do, which is watching something together and watching one of my favorite, all-time favorite shows. I might be dating myself here, but it's Friends. And it's the last season, I think it's the last season, where actually Rachel is taking care of her daughter, Emma. And she brings her home from the hospital. She loves this baby so much, right? Picks her up because she cuddles her and wants to hug her, and the baby won't stop crying. So let's talk about a pediatrician reviewing this video and letting you know where I think the pitfalls are, what I think we could change and bust some myths on, and a little bit more about babies crying.
Oh, I just want to bite her ear off and use it as a sucking candy.
Okay. But I could take one of those little feet and put it in a pita bucket.
I can't believe how much I love her.
Little segue here, I say this to my daughter all the time, like, can I take a bite of you? Can I please have a nibble of you? And my daughter's nanny and I joke, like, we're gonna give her some kind of trauma, because she's like, no. And I'm like, this is probably not normal, where I'm like, can I just nibble on your arm? Can I have a little tiny bite? And she's like, oh my God, I have this incredibly crazy trauma where someone wants to eat me. But I can 100% get all of these small little terms of endearment.
I can't believe how much I love her. I can't get enough of her. Like right now, I miss her. I actually miss her. You know, that's her. Oh, God, look at her sleeping. Oh, I love her so much. I think I'm going to wake her up. Oh, no, Rach, no, you know, you're never supposed to wake a sleeping baby. Well, I can do whatever I want. I made her.
How many of you have heard never wake a sleeping baby? Big myth. I've heard it very often perpetuated amongst moms and grandmas and people who have had no experience with kids. You are totally okay to wake a sleeping baby. In fact, if baby is due to be fed or due for waking up simply to just get up and be in a normal circadian rhythm, right? You don't want them sleeping all day and then being awake all night. You have to wake that baby. Now here, I get it, Rachel wants to wake her up just because she wants to hug her. But absolutely, you have my say-so, and almost every pediatrician say-so, that you need to wake a sleeping baby, especially in the newborn days. If you know your little one is not quite up to birth weight, still needs to be eating and regaining that birth weight to be able to sleep longer stretches of time in the future.
I can do whatever I want. I made her. Come on, little girl. Hi. Well, I would say I told you so, but she's kind of doing that for me. Okay. I'm sorry. Oh, Mom, you're so sorry. Go back to sleep.
Let's pause here for a minute and recognize that baby Emma woke up crying. And if any of you have been a parent, any of you have been a parent to a newborn or taken care of a baby, you know that this is really common, that they wake up crying from their nap. How many of you have woken up from a nap for hankering for a snack? I feel like that's always me. And somehow I meander to the kitchen and grab a piece of chocolate or make myself a cup of something warm. Kids, babies, newborns are kind of the same way. So if she wakes up crying, instead of just, rocking back to sleep and hoping that she goes back to sleep, this would be a good opportunity to instill eat, play, sleep schedule. So after they sleep, give them a period of eating and then give them a period of play. Now, obviously play as a newborn looks very different. So that might be either awake time, burping, going on a walk, tummy time, whatever it may be. But this would be a great opportunity if she's crying for Rachel to maybe feed her, nurse her, give her a bottle, a formula, whatever that may be.
All right, well, we already tried feeding her, changing her, birthing her. Oh, try this one. Go back in time and listen to Phoebe. All right, here's something. It says to try holding the baby close to your body and then swing her rapidly from side to side. Okay. Okay.
All right, guys, so it looks like she's already tried feeding her. She's already tried changing her. And now baby's not going back to sleep. What could be the reason? There's so many different things. So like, for example, if this is the second day that baby's home or the third day that baby's awake, we call this second night syndrome in pediatrics, where basically the baby is waking up now and they are starting to feel hunger and they are starting to communicate their wishes and their needs and their feeding cues and giving you a chance to really establish that bond of what they need and how you can provide it for them. Now here, it seems like the swinging back and forth and holding her close, there could be many different factors there. Now holding the baby to your chest, bringing them close, rocking them back and forth, that sounds very similar to some of the tips that I have shared in one of my prior videos on how to calm a fussy baby. I'm gonna link that video right here. There's a lot of reasons why this could be helpful. So reason number one, warmth from skin to skin. Okay, so that's something that's incredibly calming for baby. Side note, everybody, I am also, as I moved into my new home, will definitely say we have homes around us being built. So if you hear a chainsaw right now, that is the home next door being built, and we cannot control construction crews. So we're gonna keep going. Swinging the baby back and forth. So swinging baby back and forth, why would that be helpful? Well, if you think about it in utero, every time mom walked, every time mom moved, she was actually kind of swaying, and that swaying was a gentle rocking. That's why people often say that babies are often asleep during the day and then awake at night when mom is basically sedentary or resting herself. So that swinging back and forth can also provide a gentle rocking motion, similar to what the baby was used to in utero.
It worked. No, just stop, throw up a little bit. God, what am I gonna do? It's been hours and it won't stop crying.
She, Rach, not it. She.
Yeah, I'm not so sure.
Oh my God, I'm losing my mind.
Let's pause here for a second and talk about when Monica is saying she is losing her mind. This literally feels exactly what it feels like, especially if you're not used to children crying. I will 100% admit that working in pediatrics, children crying is white noise to me. If you've ever worked in a pediatric ER, in a pediatric office, in a daycare, children crying is one of those things that you recognize as a sound that you should never tune out. Absolutely not. That's not what I'm saying, but you do get used to. However, when it's your baby crying and your baby crying right there in front of you and you have no reason why, it can feel extremely just nerve-wracking, and you really don't know what to do. And this is really important here because this is oftentimes where parents are advised by pediatricians, by other caregivers, to please take a moment away. Put your baby down. If your baby's crying in your arms, your baby will cry in that crib. You holding that baby and stepping away for even 2 minutes of fresh air will not hurt either of you, but may actually help and benefit you. So put baby down in a safe place, in a crib, right? Not completely bundled up where blankets can get over their face or giving them something that could be a strangulation risk, right? This is not the time that you would do something like that. Put them down in a safe place with no objects that could impact or hurt them, and step away. This is super important because the one thing that we don't want is abuse of the child. And I say that very, very carefully because nobody ever wakes up and thinks that maybe I'm going to abuse my child because they're crying so much. Shaken baby syndrome is something that you may have heard of, but it actually comes from shaking the baby, being frustrated with the baby who won't stop crying. And there are devastating neurologic effects that can happen due to this. Now, I know this went in a really serious direction really fast from talking about something so simple like friends, but I feel like that's why it was so important for me to review this, because now when I go back and watch it, I can 100% relate to it. Not only as a parent, but now as a pediatrician, I see where this is a great time to give guidance. When shaken baby syndrome occurs, it's not just shaking the baby, it's their brain shaking within their skull. That is the devastating part as well. So yes, you worry about rib fractures, and yes, you worry about bruises, which are seen externally. The rib fractures not as much, but within the baby's skull, There are axons, there are connections, there are nerves, there are cells that have delicate connections, and shaking the baby can cause devastating neurologic effects. Some of these devastating neurologic effects can include blindness, it can include developmental delay, and in some cases, I've even taken care of patients who that it's resulted in death for.
Oh God, what am I gonna do, you guys? I can't even comfort my own baby. I'm the worst mother ever.
No, you're just new at this. You'll get better. I mean, think about your first day at work. I mean, that could have been easy, but you figured that out.
Yeah, I don't think dressing provocatively is going to help me here. Oh God, just please take her. I'll take her. Oh boy. I have to go to the bathroom. I have to go scream into a pillow.
Another really important part as a pediatrician that I want to review here is Rachel saying, I am a terrible mother, I can't even call my own baby. This is something we hear so commonly and that we fear parents thinking, especially when they have a child with colic per se, right? You've often heard that term colic, and it's really crying. I've talked about it a few times, but for 3 hours a day, 3 days a week for at least 3 months. And it is a lot of threes, I get that. But really, you have a child who is fussy and crying. Sometimes we even refer to this as purple crying. And I'll lay out right here what purple means, and we can go through the entire acronym if you'd like in a later video. If you have questions about it, I think it's super important for parents to learn about purple crying. But generally, I want parents to understand that if your baby is crying, this is not because of something you did wrong. That is really important to understand, especially if they're crying due to colic or exhibiting purple crying. In fact, most of the time there is no identifiable cause for colic or for purple crying. Now, you might find me saying those two things almost together and thinking that maybe they go hand in hand. And in fact, those two definitions do. Purple crying is generally a term that we're trying to move towards away from colic, simply because colic gives a child a diagnosis where parents feel like it was something wrong or something bad. And essentially, it is still normal. So we're trying to move away from colic and going more towards understanding that this is a period of purple crying, this is expected, what you can see in a child, when you can expect the purple crying to occur, and what you can do so that we can help prevent anything like shaken baby.
Oh my God! You got her to stop crying!
Yes, I did. I'm Monica, super aunt.
You are the official baby crier stopper!
Yes, I am.
You're never leaving the apartment!
See what?
That's your new job, day or night. She starts crying, I need you here.
Oh, no.
Well, thankfully you don't need me at all. So, okay. Hey, Super Aunt, see you later. Rachel, let's give it 6 to 8 months.
All right, guys. So I want you to understand what Rachel did here was actually the right thing. Hand the baby off to somebody. I know Monica sat there the whole time and listened to the crying too, but it really makes a difference if that infant is in your arms, because you cannot grab your arms to, I don't know, pinch the bridge of your nose, go grab a drink of water for yourself, step away. So having even your arms free, giving that baby away to somebody else who's nearby, whether that be your spouse or your partner or your other child's caregiver, like a nanny, let's say, that you had for the older sibling. Stepping away if you need to in a safe place, or putting baby in the stroller or the crib if you don't have anyone nearby. Stepping away. This doesn't mean like leaving your house and leaving the child unattended. You're just stepping maybe into the next room for a minute, getting outside for a little bit of fresh air maybe. These are all really important measures to, again, protect your mental health as the parent. Now, I think something super important to recognize here too is Phoebe saying, Rachel, we'll see you again in maybe another 6 to 8 months. Listen, it does not take that long for the crying period to resolve. In fact, I typically tell parents like the first 6 to 8 weeks are a very hazy newborn period, for sure. But by 3 to 4 months, your child is definitely not the same fussy child as they were before. If you are concerned, please do not hesitate to reach out to your pediatrician. This is what we are here for. This is what we do. We want to make sure your child is crying for normal reasons and not something that we can help you with, perhaps reflux or something else that could be concerning. So please reach out to your pediatrician. I hope this was helpful. I love Friends. I could watch every episode with you guys, but I'm not really sure how helpful that would be as a pediatrician. If you have other episodes of Friends that have pediatric references that you'd like me to review and watch with you, please shoot them in the comments below. I'd love to watch it. I hope you guys have a great week. Bye.